Welcome back to Startup Health TV, where we celebrate the entrepreneurs and the innovators who are transforming health. I'm Logan Plaster. My guest today is Vicente Ferrer, the Managing Director in New York City for Medictor. Vicente, always good to see you.
Likewise.
So, we've talked in the past
Yes.
about this interesting triage tool you've developed. I want to hear exactly where it stands in 2023 and this interesting project you're doing in Colombia. So,
Yep.
so sort of level set on the product and then we'll move into traction.
Absolutely. So Medictor basically empowers patients by offering them personalized, on-demand healthcare guidance at the first onset of symptoms. And the way we do this is basically by partnering with health plans and health systems, right? So Medictor enables these players to direct patients to the appropriate level of care on a safe, convenient, cost-effective way, anytime and anywhere.
Okay. Let's walk through a patient journey who's using Medictor. How do they find it? Is it on your website? Is it on the hospital website? How does it work?
Exactly. So we can take, for instance, this project you were referring to, Albany Med, Columbia Memorial Health. Medictor is embedded into their website, into their app, and we have actually created a specific condition landing pages.
Okay.
All of them with the look and feel of Columbia, right? Nobody knows about Medictor. And they push it elsewhere. Just try to find that patient that is out there, Googling their symptoms, worried, and that doesn't know what to do next, right? Because this is what we answer eventually.
Yeah.
That patient knows perfectly how she or he is feeling, but doesn't know what's next step. Where should they access in the care continuum, right? So we answered that question for them.
So they might start anywhere, on Google or wherever, and then they end up at their local
Yep,
health facility, and that facility has a triage tool,
exactly.
and then they start using the Medictor tool white labeled for the hospital.
Exactly.
Okay.
That's correct.
So it walks them through a questionnaire. How does it work?
Yeah, it's basically more than a questionnaire. I would say that it's an assessment that starts with a free text that the patient is going to input with her own plain words how she feels and can input as many symptoms as she wants at once. And then it's a process of, let's say, 14 questions, less than 2 minutes. And with all this information, we're able to tell this patient, look, this is the correct level of care for you. And this health system, in this case, Albany Med, is suggesting you to go to telemedicine versus in-person visit like a PCP, synchronous versus asynchronous care. So it's basically around that area that we work.
How do you validate a tool like this to know we sent the person to the right place?
Absolutely. I mean, we believe that the same way new drugs, new medical devices has to go through a process of validation, digital health companies should do the same, right? So we take very seriously the validation, and we do this through clinical studies.
Okay.
Basically led by independent third party, responsible for creating the protocol, gathering data, communicating the results, always with real patients in hospital settings. And, the results got the attention from peer review magazines that decided to publish the results. So clinical validation is deeply rooted in our DNA. Just remember that one of the co-founders, Dr. Garcia Esquirol, is a doctor himself. So he was very clear from the very beginning that we needed to go that path.
Now, one of the unique things about Medictor is that you were born in Spain, and
Yeah.
you've branched out all over the world. This project you're describing is in Colombia. You've got a global footprint, a global perspective.
Yes.
A lot of companies that we work with are relatively U.S.-centric
Yep.
because of the market. How is it a differentiation, or how is it even a competitive advantage for you to have that global perspective?
Well, that's very important because eventually every single market geographically is different, but being able to learn best practices elsewhere and try to adapt them to the American reality, that's, I believe, a strength. And don't forget the fact that we come from like a rather small country compared to the States, so it's been always for us kind of compulsory to grow outside,
Yeah.
right? And we feel comfortable, and that's something that I think that the companies we work with, our partners, they truly value what we are bringing to the table in that sense.
How crowded is the market for automated triage like what you're doing?
Well, that's an interesting question because there have been like a few updates around our space. Companies like Babylon, Buoy are not anymore. in the space, which means that there are less competition. But I think that is the right competition, right? Because when you are in an innovative space like ours, you really want to have like good competitors that help you grow the market. That's something that we missed in the past, but we believe that with the new, let's say, batch of companies in the space is going to help us better communicate our message, our value proposition, and overall make bigger the market.
Instead of trying to create the market and plow forward, you've got other folks helping you define the market.
Yeah.
Interesting. I haven't really had anybody else sit down and say they wanted good competition.
Yeah, it's fundamental.
Interesting.
It is.
Interesting. Is that part of your perspective? You know, it's do you think that's part of your roots in Spain or your European mentality or?
Yes, as I was saying, in Spain, we are used to compete because we have to grow outside our domestic market. So for us, it's something that we truly value and we learn a lot.
You embrace it.
Yeah, we embrace it.
Okay. What's next for Medictor?
So next, I would say it's here in the States, it's going to be keep growing on the health systems and hospitals. Right now, on top of Albany Med, we are working with Blue Stem Health out of Lincoln, Nebraska. We also have relationship with Yale, Austin Renal Clinic. We are in meaningful conversations with a bunch of tier 1 hospitals. I think this is where we are going to put the focus for 2024. We are seeing a lot of appetite for our solution, and we expect to harvest on that, honestly.
Yeah. Is that appetite growing because of the fervor around generative AI and just conversations?
It has helped a lot for
Yeah.
us, yes. All of a sudden, ChatGPT and all these large language models put the focus on us,
Yeah.
right? The spotlight.
The idea of being able to go on ChatGPT and say, this is how I feel, where should I go, and get sort of a dumb answer,
Yep.
an answer that's not validated.
Exactly.
That is now in our psyche. Like, I should be able to do that.
Exactly.
And Medictor, I'm guessing, says we can do that for
Exactly.
real.
No, and actually it moves the conversations with our prospective clients to a different level because you don't have to focus on the roots of our technology. That's for granted right now. So you you focus on the value proposition, on the use case, which is much more meaningful.
That's good.
Right. So
Do you see an inflection point happening? Like, you've been working, how long has Medictor been?
6 years now.
6 years,
Yeah.
you've been pushing. Do you see a tidal shift in terms of
Absolutely.
appetite?
Absolutely.
Yeah.
Has nothing to do. COVID-19 helped a lot.
Yeah.
Then ChatGPT. So has nothing to do with 6 years ago. Nothing to do.
Yeah, it's kind of a perfect storm.
Yeah.
In a good way.
Yeah, in a good way.
Vicente, thanks for coming by. Appreciate your perspective. It's been exciting to watch Medictor these last 5-6 years.
Yeah.
You're doing awesome work, so keep it up.
Thank you so much.
All right.
Yeah,
Take care.
Take care.